Hello, welcome to A to Zig. Our program today is about the COVID crisis. That's why I'm wearing a mask. As you probably know, we're in the middle of a epidemic here. Actually, it's a pandemic around the world. And what we have discovered is that we're being tested in so many ways. Today's program, we're going to cover a number of things. I have with me Dr. Stephanie Biasi, who is a veterinarian and also has a master's in public health. And she's going to be sharing with us information specifically about her research with veterinarians and the One Health approach, which is an interesting way to look at zoonotic diseases. I'm also going to be talking about research that we just completed with 26 hospitals and 24 public health agencies in the state of Michigan. And I'll be sharing some information about what the COVID impact has been with them. More importantly, this program is about becoming aware of how serious this matter is and also that there's a way forward with public health. So with that, I'd like Dr. Stephanie Biasi to start by sharing a little information about what's going on in our country currently. Thank you, Dr. Biasi.
Okay, thank you, Dr. Kozicki. So in looking at the United States, this is a representation from the Centers for Disease Control and Prevention that is updated daily that viewers can see, and this data is from yesterday, the latest data that I was able to get. And the numbers of Americans that are affected with this COVID is over 7 million, 7.7 million individuals have COVID. And the number of deaths is at 214,108. On this map, which is, again, this is what was reported to the CDC. This looks at the New York Times and COVID in the United States, and it shows how there are some curves that happen. We had an earlier one in the spring. You can see the bump there, and then in the summertime it went as a bigger bump. And then later on, we can see that there's an upward trend that's happening right now that we are currently in as the cases continue to rise. This is a graph that is updated on a weekly basis from IHME, which is the Institute for Health Metrics and Evaluation. This is looking at the United States, and the curve is more smooth than what we saw with the New York Times representation. But what you can see on the right-hand side is 3 dotted lines. And these are projections of what could potentially happen. The middle line is where the numbers are coming from based on what the projections will be as time continues if things are kept pretty much the same. If we were to stop doing the mandates and easing on restrictions, the red line, which is going very high upwards, which would increase the number of people affected and dying, can be seen. And if we were to have universal mask wearing, the number is lower. That's the lower dotted line. So we can see that mask wearing and other mandates that the governor is wanting us to do would be the best way to go to protect lives. This is looking at Michigan. So similarly, we have this rise, and you can see, again, see on the right-hand side how easing mandates would make it go exponentially higher in the number of people affected. Currently in Michigan, this is looking at just the data that's updated daily with Michigan, and we can see the number of people affected here, and the numbers are continuing to rise. The colors are showing where the greater percentage of people affected for each county is demonstrated there. And I'm going to turn this over to Dr. Kozicki.
All right. Well, obviously, with these kinds of numbers, we need to prepare. And how do we prepare? Well, I want to say this in a nice way. We really haven't been prepared for this COVID-19 coronavirus, and we really have to be realistic about this. If we don't do something about this next wave, which is coming, whatever we've seen in these first 2 waves will be multiplied much more. In fact, let me talk about this. Recent research that we just completed with 26 acute care hospitals and 24 public health agencies, which was from June 8th of this year through September 23rd, basically showed that all of the healthcare providers do not think that the COVID virus has ended. The response from all representatives was that it is not resolved. So let's be real clear about that. This thing is not going away. It has not gone away. It is here. And so this is the real challenge that we're experiencing. The hospitals and public health agencies already have been really stressed because of this, and I'll go into that a little bit. And if we have a third wave, which is going to be worse than the first two, many of these healthcare systems are going to fail. They're going to collapse under the pressure of more cases. That is why it's so vital to wear masks. That's one of the things that Dr. Biasi just pointed out. If we wear masks, we're going to dampen down this curve. We're going to have less cases. And so there's no excuse for not wearing a mask. This is not a civil rights issue. This is not an issue of politics. It's a public health issue. Wear a mask to stop the spread. And I think that's really important to emphasize. So let me talk a little bit about COVID-19 here. It's a zoonotic disease. And what we know is that a great portion of the illness that we have in our world comes from animals. And Dr. Biasi is going to talk a little bit about this more when we talk about the One Health Project. When we look at hospital operations, how they've been affected most recently here in the state, here's some things you need to keep in mind. The COVID-19 epidemic has caused significant stress to 87% of the hospital-based healthcare providers. Almost all of them have been significantly stressed already. And remember, I said there's another wave coming. 91% of the hospitals were working in conjunction with public health agencies. That's a good sign. That shows that there's coordination going on at the local level. 92% of the hospitals needed assistance to respond to the COVID-19 epidemic. What does that mean? It means that with the facility in its operation as it was, they still needed help. And I'll talk about that in some detail. 83% of the hospital representatives reported that COVID-19 had changed the mission of the hospital. So this is an amazing thing that's taken place. So let me talk about how the public health agencies have been affected by this. COVID-19 epidemic has caused significant stress to 92% of the public health agencies that we surveyed. 92%. That's almost all of them. 96% of the public health representatives reported that they were working in conjunction with hospitals, which again shows there is a coordinated effort, a command center between public health and the hospitals in your community. That's good news. 97% of the public health organizations needed assistance to respond. Just like hospitals, they did not have enough resources, and I'll talk some more about that. 85% reported that COVID-19 has changed the public health mission. So for both hospitals and for public health agencies, COVID-19 has changed their mission. So what are some of the things that we are seeing that are necessary if we're going to prepare for this next wave? This next slide here goes into what we didn't have the last time around. Didn't have enough supplies. And the supply chain was, in many cases, unable to bring the necessary supplies to hospitals. In fact, in this survey, we found that some hospitals were actually getting masks from community groups that were making them for them. Think about that. Modern hospital has to rely on a sewing circle or a community group to make enough masks for its employees. There was a problem with testing. Still is a problem with testing. We're not getting enough tests done, and the tests are taking too long in many cases to be read, and the sharing that needs to go through into the case follow-ups. There's staffing shortages. And in many cases, people were pulled from jobs they were doing to actually work in ICU or other areas where they had to be retrained quickly to be able to do this. Lost revenue. Most hospitals have lost a lot of money, and I mean a lot of money, that they couldn't get because they weren't doing elective services. Navigating the changes that government recommendations were giving them was also a problem, because there was inconsistency. There was messages coming from multiple sources. Hospitals oftentimes didn't know what was the official stand that they were supposed to take with regards to patients. So oftentimes they had to make these decisions on their own. Community was left to decide what should have been a national priority. There were communication breakdowns on an ongoing basis. The community trust to some degree was lost. When we see our hospitals and public health agencies struggling, we start to wonder whether they're actually going to be able to deliver us. And that's really important because we want to trust these people. We want to believe that what they're saying is actually going to help us. Cost reductions. Many hospitals are looking at where they can cut costs, and that means possibly laying off people or stopping certain services, shutting down facilities that may not be possibly returning on investment. There's going to be a real sweeping change. Already in Michigan, before COVID took place, 50 hospitals were having financial problems. This COVID epidemic is going to cause stress on many of these hospitals, and don't be surprised if some of them either shut down or reduce their services permanently. So maintaining a safe environment was also a challenge for a hospital. When you walk into a hospital, it's a big place. It's very easy for an epidemic to spread through there. So let's look at the public health challenges. This next slide really kind of identifies what they were going through and will be going through. Staffing shortages, not enough people. Public health has always been underfunded, and during this time of crisis, it really showed. Limited testing supplies, contact tracing, not being able to do it, not being able to find the people who are infected, quarantine them, and stop the epidemic. And it's still a problem today. Funding, not enough money there. And then the politicization of the disease. The political people have jumped in the middle of this, and in many cases caused a lot of confusion by saying things like this virus is going to go away by itself. PPE supplies to protect people. Enforcement of public health guidelines. Public health workers are afraid for their life because when they step out in the community and want to enforce guidelines, people tell them they're going to be shot or they're going to be beaten or they threaten them. And so they're not able to enforce the kind of guidelines that are necessary to stop people from spreading this disease. And people not believing that COVID-19 is a threat. We still have a large portion of the population who think this is nothing to really be concerned about. Even though, as Dr. Biasi had pointed out, we've had 200,000+ people that we know of that have already died from this. So let's talk about the One Health project that Dr. Biasi has been involved in. One Health is defined as an integrative effort of multiple disciplines. So we've got human medicine, animal, environmental health people working together to come up with an achievable, optimal health plan for people. And it takes a look at animals and environment. And I do want to mention that climate change has a lot to do with this. Climate change moves some of these vector diseases, and the globalization that we have experienced makes it so much easier for many of these contagious diseases to spread. One Health is something that both hospitals and public health agencies are not totally committed to. Our survey found that only 54% of the hospitals and 65% of the public health agencies are invested in the One Health project, which means we have a lot of work to do there. And hopefully we'll be able to look at that as being a priority because of this COVID epidemic. If we think about One Health in Michigan, this is something that Dr. Biasi, in her research with veterinarians, really can give us some additional insight into. Dr. Biasi?
Yes, well, thank you. And so I had done a survey of Michigan veterinarians and looking at their prevention, zoonotic disease prevention practices, including the influence and knowledge of One Health. And of the 3,000+ veterinarians, I had a number of about 400 that had responded to the survey, and comments that they had given to me in regards to One Health. Most of the veterinarians knew of One Health, especially if they had graduated from veterinary college more recently, within the last probably 10 years. And so human health care needs to help veterinary health by supporting the importance of vaccines, preventative kinds of things, as well as testing. And human medical personnel tend to not be as aware of zoonotic disease as veterinarians. So most of the thrust of the responses that the veterinarians had contributed was that human medicine in their education needs to have a greater play or relationship or interactions with veterinary education, either veterinary students or veterinarians, because we're all working in this helping of health of animals and people together, and it should be a cohesive effort. So another comment was that some things that would be helpful to educate medical doctors on the topic more so than what has been done in the past, since veterinarians realize that they know a lot more about zoonotic diseases than the medical professionals do.
Okay, so One Health is one of the challenges that we're dealing with here. And it's really important to keep in mind that this effort right now that we have with COVID is with a zoonotic disease. COVID is a zoonotic disease. And we will be seeing more zoonotic diseases, more illnesses like this in the future. And as hard as this might seem to appreciate, this is not the worst pandemic that we could experience. We could experience a pandemic 10 or 20 times as bad as this one. So as inconvenienced as you are right now, as much as you're put out, think about what your life would be, what our lives would be, if we don't do something different in the future. This is really a warning. COVID-19 is a warning that if we don't change our ways, we're going to see even worse situations in the future. And now keep in mind, our healthcare system, our public health agencies have been stressed by this. So we need to do things differently in the future. We need to start thinking about how we're going to re-engineer the hospitals, the acute care systems, the veterinarians and all the support people into more of a population health model. We have to be thinking about how do we protect the population. And if you don't understand this, acute care is mostly about taking care of the person, taking care of me, making sure that I get surgery or that I'm well. And I appreciate that. You appreciate that. But population health, public health, is about taking care of the entire population. And when we talk about infectious diseases, when we talk about COVID-19, this requires a special new way of thinking. And more importantly, it means that the public, you and I, must get on board with this. We can't be acting as if this is something that is a fable, something that's made up. It's real. And for everybody out there who is not cooperating, I ask you to cooperate. Wear a mask. Wear a mask to protect me, to protect my children, to protect your grandparents, to protect people who could catch it and die. I just read, just a few minutes before I came on, of a 13-year-old girl who had COVID, and they went on a family trip, and all of the people in her family are pretty much now infected by it. One person. And you know, so it can spread within a family. If you think about your family's safety and you worry about it, then you certainly want to do all the things that are necessary. Social distancing, wearing a mask, washing your hands, avoiding large gatherings. And more importantly, if you are infected, quarantine. Don't infect other people. Spend time away from other people because you'll just spread this condition. So, Dr. Biasi, we were looking at the number of cases in the United States in the last 7 days. 344,000 cases in the last 7 days. That's astounding. That's just.
It is.
It's
yes.
almost hard to believe that we could have that many infections in 7 days.
And the numbers of cases that are happening on a daily basis, and the number of deaths. I check the site about Michigan every day, and looking at the numbers of cases in Bay County and Midland County and Kent County, and it's just it's scary.
We've seen a spread too in the UP. I think one of the things you had up here was the map which shows what's going on in the state. You can see that the spread is been mostly in southern Michigan and now spreading out of Wisconsin into the Upper Peninsula. And you can see these dark areas as being areas where there is a more pronounced infection rate, with the center of the state not having as much. Keep in mind too that there's less people living in some of these places, but the infection rate doesn't really care if there's one person or 1,000 people. Once the R factor gets above a certain number, then we're going to see a lot of infection. And looking at this, you can see that Detroit is still a hot spot. If you look across Michigan, you can see that all the way up the I-75 corridor up into the Tri-Cities, which is Bay City, Saginaw, Midland, we see that there's a spread. And along the western side of the state, there's a spread into Kent County, up into Muskegon, and then we're going up in the UP. You can see how those areas that touch on Wisconsin, where there's a runaway infection rate right now, are being affected by this. So we have to be conscious of the fact that we're living in this environment, and that it is an environment that we must prepare for. So how do we prepare for this? First of all, it's accepting the fact that we do have this pandemic. Please be realistic about this. There's nothing phony about this. This is not something that's made up. It's the real deal. And I know people personally who've lost family members in this epidemic already. You know, all of us need to change. All of us need to change. So Dr. Biasi, let's talk a little bit about the One Health approach to deal with this issue. What is it that we can do differently, you think, on a community level to prepare people for dealing with this?
I think it is something that needs to be promoted to the public, that they need to really be washing their hands after handling animals, and that diseases come from handling animals. Whether you're deer hunting and you got your first buck and you're so excited, you need to be concerned about making sure that you're washing your hands and using hand sanitizer if need be after having contact with animals, whether it be your dog or your cat, or we had a bat in our house the other day that we had to get rid of. That you have to be cognizant of the fact that animals can give diseases, and they give 60% of the diseases to humans. So we have to have a campaign to make sure people are aware of that.
Yeah.
You can't sleep with your dogs and cats and think that isn't going to potentially infect you with something that they might be carrying.
Well, but they're so furry,
Lyme's
and we like
disease,
them. We pet them. And
tick levels
Yeah.
have increased over these last several years.
Lyme
and
disease.
Lyme disease is a major problem in areas, and it's getting worse.
Yeah. How many ticks can live on a deer?
Thousands. I've read a book about it, thousands, and especially around typically the anus is an area that you might not think that it would migrate there, but there's not much fur, and so that's where the ticks tend to congregate. But regardless, ticks carry not only Lyme disease, but other diseases, babesiosis, Rocky Mountain spotted fever, anaplasmosis. There's other diseases that can be transmitted, and I've heard of people who have had those in Michigan and have been really, their health has been compromised significantly.
Yeah, I've worked with people who've had Lyme disease, and I know that in many cases they've had to stop working. They can't function anymore in the roles that they've had. So now it is conjectured that COVID-19 may have come from a bat. We're not sure of that yet, but
Correct.
There's a real strong possibility that a bat somewhere along the line was the source of COVID-19.
Correct.
And
well, it also has been the source for SARS,
okay.
the outbreak that happened some time ago. So
Sure.
there's a lot of diseases that they think come from bats and then transmitted to maybe another host that then gets to humans. And then once in humans, if it's going to be transmitted human to human, then it goes like wildfire.
Sure. And I think most people are concerned about avian flu, about the possibility that we're going to have a bird flu, and birds migrate, they cross paths. It would spread across the globe very quickly. And that's the one that most people are preparing for, because that's the one that they think will take us by storm. Now, as Ed mentioned earlier, now that we've had this COVID-19 pandemic, we're woke. We're aware. We know. We have no excuse. I know the last pandemic was 100 years ago, and there's very few people alive that know about it. But right now, we're woke. we should know that this is a time to make things differently. And what do we have to do? We have to invest in our public health services,
Yes.
our agencies, in all of the things that they do. And we have to also ask public health and human medicine to start working together. One of the nice things that we've seen here is that over 90% of the public health agencies and hospitals during this COVID time were working together. Let's make that the regular process. The other thing is we need to get this One Health thing going so that it becomes a part of the way we deal with things. And the other last thing that we need to do is we need to start investing in population health. We need to start looking at the population as a whole and not just the individuals. That doesn't mean we give up on acute care services, but our healthcare system needs to be re-engineered so that population health becomes a much bigger portion of it. There's prevention there. There's also the possibility of educating people. If anything, this COVID epidemic has taught us that many people don't understand contagious illness, don't understand illness at all. We need to give them the knowledge so that they can make good decisions for themselves and their families.
And I need to interject that One Health is not only human health, animal health, but it's also environmental. We have to have the environment be considered, and the global climate change that's going on has contributed to habitats changing and more animal migration and interactions between people and humans, and it's all kind of coming together that we need
Perfect storm.
Right.
We are in a perfect environmental storm. So anyways, thank you for joining us for A to Zig, the COVID crisis. I hope that you are more aware, you're also more engaged, and you're willing, like me and everybody else, to work together so that we can deal with this crisis and the next one, and the next one, and the next one. Goodbye, everybody. Stay safe. Be well. And if you have a mask, I would suggest you wear it. And if you don't have one, please get one. Thank you, everybody. Have a good day.